We've heard a lot today about the changes that are taking place at a national level, but obviously it's one thing having the policy, it's one thing at that level, but putting it into practice is very much going to be down to the local level and how we work at a local level. And I really want to talk, because my role at the moment is supporting parent forum involvement in health, and that is really, really crucial at the moment. But I think it'd be really good to sort of just take a step back, because I've heard for the last 2 years how difficult it is to actually get people involved in health. Gareth made a mention of the fact that there's big changes going on, and I think participation, what we do is about getting into dialogue. What we want is the commissioners, the managers, to understand what it's like for us and from our perspective. But if you're trying to work with a group and you're finding them a bit resistant to come and join you, it often really helps to try and sit down and see it from where they're sitting. So for 2 minutes, I just want you to close your eyes and start trying to imagine what it's been like for them. So I'm going to give you, rather than focus on health, what I want you to do is just sit there and think at the moment about your local authority, because you're probably more familiar, all of you will be familiar with what your local authority does. Think of the town hall back where you live and the people who work there. And then suddenly think, what if they didn't exist from the 1st of April? I'm not just talking about disabled children's services here, or looked after children, or foster children, or adult social care. Think of all the other things the local authority does. Your street lights, your road repairs, your dustbin men. Think about your leisure, your parks, and all the people who are responsible for making sure these services happen. And imagine that on the 1st of April, 2 brand new organisations were going to take up running them. And all the people who've been running them up till now have been having to think about not just running those services, but actually getting ready to hand them over to somebody else to run. And they've only found out about 3 months ago where a lot of those services went. And the people who work, all having to move and change jobs and work for a new organisation on the 1st of April. And as well as keeping your service running, as well as getting ready to move, you've also been trying to help those new organisations set up. And that's what it's been like for primary care trusts and commissioners in health for the last year. And it is massive. So just imagine what it must be like as one of those managers trying to juggle all those balls. And if, in the middle of all of that, somebody comes and says, "Oh, I've got something else for you to do," what's your response likely to be? But if somebody comes in and says, "I think I could help you with some of your problems," you're more likely to be welcomed. So one of the key things now is clinical commissioning groups start on the 1st of April. It is really important that we actually do get into that conversation with us. But we must remember when you last moved house, how many months did it take for you to really sort the house out? These clinical commissioning groups, a lot of the people moving in there are just starting on the 1st of April. They're unpacking the boxes, they're trying to work who else they're working with, and they're still trying to work out, well, what exactly am I meant to be doing and which services am I managing? They're also at the back of the mind of the clinical commissioning groups is that over the next few years, they're going to be expected to make efficiency savings. That's what's in their thing. And of course, the other thing for us, Gareth mentioned this about, well, it's not important for GPs to understand, but actually, we're talking about these commissioners, these people managing the clinical commissioning groups have the budgets that control and decide what spending will go on the therapies, the wheelchair services, the continence services, the child development teams. Actually, we really want those people making those decisions to understand not only how important these services are, but how they must be joined up and how they must be integrated. And of course, the other key thing now coming through the Children and Families Bill is the clinical commissioning groups are the link with the local authority around those single assessment plans. Really important we get into conversation, but really important that we remember that on the 1st of April, they won't know, they'll still be settling in, and they probably still haven't actually quite worked out what it is they're meant to be doing. There are some guides out there. Some of you might have seen the GP guides because I have been going around telling people. But on your way out, you will find on the table, as you dash for the train, there's 2 new guides we've brought out, which are for GPs, but they're also for clinical commissioning groups. They're really there to help you start the conversation going with clinical commissioning groups. One of them is called Making Your GP Service More Welcoming. Because clinical commissioning groups, one of their duties that they do know about is they've got to try and improve the way GP practices work. And by simply reading that guide, it will also help them begin to understand some of the problems for disabled children in accessing not just appointments in GPs, but appointments in hospitals and community services and all of those. The other guide, which is very much about which is about the services, and it describes to GP what the services are that disabled children use. We've heard very much about the single assessment plan, and we know that is for children with more complex needs. But how many of our children do we hear who actually go through an assessment process, who go through a diagnostic process, and then told, well, now your education and social care's problem, they're going to look after you. And those families fall through that gap. They don't pick up information about help for sleep and strategies for behaviour, and even basics like the community dentist and how they can actually help children who can't get to the local dentist. So in these guides, there is information for GPs about how they can signpost families as well to these basic things. One of the key things that clinical commissioning groups do know they're doing, and they do know they want to do, is patient involvement. They are very much aware that they've all got strategies now for patient involvement. I've certainly been hearing from forums the last 2 months who are now approaching the clinical commissioning groups because they're now authorised, they're now ready, and when you go in there and actually introduce yourself, they're actually saying, actually, yes, we would like to work with you. So you're going in saying, I think I can help you with your participation strategy. That's the way in, because you're going to be nice, kind, helpful people and start the dialogue. Because actually, it's the dialogue that really makes it matter. Once they start hearing what the experiences are of families, then they get a picture of what needs to be done to put right. So please grab these on the way out. You'll also find in your packs, there's a handout called Clinical Commissioning Groups Introducing Yourself. And really, it's about when you go in there, don't describe yourself as a parent carer forum wanting to get involved with the local offer because they won't understand. Say, I'm a parent carer forum who would like to be, what have they called them in the strategy? Oh, a patient participation group around services for disabled children. Use their language. When they read it, they'll understand it. It'll be easier. And they'll suddenly think, oh, they are just the sort of people I'm looking for. So that's it. The other thing is make sure when you feedback families' experiences, because they are clinicians, they went there because they want to help families. And actually we know that when professionals hear about what the experience is like, that is what motivates them for change. But always remember to say, well, you're hearing about the experience of 2 or 3 of our members, but we know from our forum this is affecting lots of members. Make sure they understand this isn't individual, this is common. And last of all, health's complex. There's masses and masses to change. You've only got limited capacity. So we're not going to change the world overnight, sadly. Pick what you can work on that makes sense for you and actually take it at a pace that both the forum as well as the clinical commissioning group can manage.